Today's is a special episode celebrating World Autism Awareness Day, which is celebrated on 2nd of April every year. Autism is a developmental disorder and a spectrum disorder. Those having autism or autism spectrum disorder, ASD for short, mainly experience distress in three major areas, that is, language or communication, social skills, and behavior. It is a spectrum disorder and it can range from mild to severe. For example, while some with ASD can lead fairly independent lives, few others may be completely dependent, requiring assistance even for activities of daily living like brushing, wearing clothes, eating, etc. Others may lie somewhere in the middle of the spectrum. Basically, that means the disorder can be mild, moderate, or severe. Symptoms could lie anywhere on the spectrum. So, each person with autism is unique, having his or her own set of unique strengths and challenges. Dr. Stephen Shore very rightly said, if you met one person with autism, you met one person with autism. We can't have a preconceived notion that all people with autism are the same. The causes of autism are not exactly known, and there is not just one cause, but it is believed to be a mix of genetic and environmental factors. Early diagnosis and intervention is very helpful for the child. To know more about autism, we have a very special guest with us today. Mrs. Hannah works in the Developmental Pediatrics Unit in Christian Medical College and Hospital, Vellore, as a senior psychologist. She has vast experience doing therapy with children with various needs apart from autism. Developmental Pediatrics Unit in CMC Vellore has a team of experts who cater to the needs of children with various needs like ASD, learning disabilities, cerebral palsy, developmental delays, and many more. I've had the opportunity and privilege to work with Mrs. Hannah in CMC Vellore, and it was indeed a very enriching experience. So let us hear from the expert now. Over to Mrs. Hannah.
Autism is a developmental problem that affects a person's social interaction, communication, and restricts a person's way of thinking and behavior. Most of the symptoms are evident by 2 years. At 1 year, a typically developing child would say one clear, meaningful word like mama, papa, tata, etc. A 2-year-old would have 2-word phrases like come here, take this, mama, bye. If these milestones are not attained, then look for other signs. Regression in speech, maybe they were saying something but has regressed over the time or had a delay in speech from the beginning. Not pointing, rather using other people's hand to point, whereas a typically developing child would be using gestures like pointing, nodding, waving, etc. to communicate. Does not make eye contact during interactions, does not respond when called by name, does not show pleasure in social interactions, rather prefers to play alone, does not share interests, approaches only to parents. Fixated in interests, repeatedly doing the same interested activity and not happy when interrupted. Difficulty in transitions from one activity to another activity. Children with autism will respond differently to sensory input. What we perceive as simple and ordinary and sensation, the child with autism may feel unpleasant, stressful, or enjoyable. No two children with autism are alike. Each child is unique. Just like how we monitor physical developmental milestones of a child, we should also monitor a child's social and communication. Seek help as early as possible because, like other problems, autism also can be managed if identified early. Many children with autism have additional medical conditions like sleep disturbances, seizures, gastrointestinal issues. Addressing these can improve their behaviors. The early we detect, we diagnose early, and with early interventions, we see better outcomes. Meanwhile, as you notice these symptoms, things that you need to do at home immediately is to structure the home environment, follow a schedule, which will help the child as well as the caregiver to understand the need of the hour. Meaningfully engage the child in play, encourage them to eat on their own, even if it is messy. Let them explore. Encourage a lot of outdoor activities. Provide opportunities for sensory play where the child can explore and learn through sensory stimulus. Use visuals along with verbal instructions for an autistic child to comprehend better because most of them are visual seekers. Example, like if you are taking the child to brush, along with verbal instruction, show the picture of the same child so that it will be helpful for the child to understand that this is the time for brushing. Prime the child to new situations and beginnings before expecting them to behave well. Use appropriate reinforcements consistently. Early intensive behavioral interventions involve a child's entire family. Each member in the family is equally important and has a role to play along with the professionals. Thank you.
Thank you, Mrs. Hannah, for your valuable words of guidance to help children and families with ASD. Due to lack of awareness, many children go undiagnosed and do not receive help and struggle in life. Sometimes, parents may notice something wrong with their child but don't consult the doctor, thinking society may look down upon them if their child is diagnosed as ASD, or due to lack of awareness, they may just feel that the child may become normal as he or she grows older. By doing this, they lose out on precious therapy time, as early intervention works best. If you have any concerns regarding your child, or if you recognize these signs in other children, please consult your doctor or encourage the other parents to consult their pediatricians if there are concerns about their child's development. Early intervention and therapy is very beneficial for the child. Treatment and therapy could include medicines, play therapy, speech therapy, sensory integration, behavioral therapy, etc. Since each child's needs are different, the doctors and therapists will assess and see what is suitable and needed for the child. And as we have heard, family support is very crucial in therapy. Some toys that help children with autism include, but are not limited to, bubbles, puppets, activity centers, ball pit, balance boards, touch and feel books, etc. Some simple things that we can do to spread awareness in our own small way. 1. Autism Speaks, the largest autism advocacy organization in the United States, encourages people to participate in their Light It Blue campaign in April for autism awareness. We could follow that too by wearing blue for the day, change our WhatsApp and FB status to blue, use blue lights at home for the day because blue is the theme for Autism Awareness Day. And if anyone asks about it, you can easily use that opportunity to share with them facts about ASD. 2. We can read any book or watch some shows related to autism to build awareness. Julia from Sesame Street, Rain Man movie, My Name is Khan, The Curious Instant of the Dog in the Night Time, Anything But Typical are some movies and books related to ASD. There are many more that could be added to this list. By reading or viewing shows related to ASD, we can make ourselves more aware of the problem and help others around us by encouraging them to seek help and understanding them instead of judging or looking down upon them. 3. We can support employers, institutions, or businesses that cater to the needs of people with ASD in our areas. Like sometimes we can see some special schools selling handmade crafts and items specially made by the children there. Supporting them is a way of showing we care for them. 4. As parents, teach children inclusion and encourage them to be caring and empathetic and non-judgmental towards individuals with ASD and generally also with individuals who may be different from us. And before that, as adults, we have to be good role models for them to emulate. Seeking help is a sign of strength. Seek help early to experience the benefits of early diagnosis and intervention. I hope the Stone of Help video would reach out and be helpful to you and those around you. Please share this video with others to be a blessing to those around. Do subscribe and click the bell icon to receive notifications on more such content and encourage us. This is Lucy.Edwin, psychologist and educator, signing off. Thank you and have a nice day.